Exactly how I use myrehabexercise.com in my own clinical practice as an example. First in the morning, I'll come in and log in at myrehabexercise.com. And once I get to the home page, I can go directly to the exercise videos tab, and I'll leave this open on my desktop. All of the videos that are on the site currently are there, and you can stratify them or filter them here and also here. Let's say I go in and see a patient with some mild shoulder pain as a secondary complaint, and my assessment indicates that there's some problems with thoracic spine mobility, some problems with some tightness in the pecs and the internal rotators of the shoulder, and we want to try to get that patient dialed in before that becomes a full-blown impingement syndrome. So I'm going to go over to shoulder. That's going to filter my exercises now down to just the ones applicable to the shoulder. And I'm going to choose to show them how they can work on some home mobility with some foam roll exercises. We'll give them a custom bit of information here. There we have perform 3 or 4 minutes on tender areas before workouts. We'll save that. And now we also want to improve the thoracic extension and rotation. I'll go over here. Incidentally, that foam roll stuff is going to include some work with lacrosse balls, very similar to what you see with Kelly Starrett, Doctor of Physical Therapy on Mobility WOD. Now I'm going to go over and use something from Eric Cressy's work. We've got the sideline thoracic extension and rotation. I click on that, and I'm going to have the patient to perform 10 repetitions of that daily, just once, for improving the scapulothoracic mobility and the thoracic spine extension and rotation. And then I'm going to work on integrating that into a better movement pattern, adding a little weight to it. So I'm going to borrow one from the Gray Cook and Brett Jones material on shoulder rehab using kettlebells. And I'm going to go over here and click on the arm bars and screwdrivers. And we're going to have them to perform 6 repetitions in 2 sets. And we'll do that daily as well. We click on that. Now we have our full exercise prescription laid out for the patient. And I click on email and type in the patient's email address, and you're done. You close the site, close that out, go up and hit refresh, and your desktop is now ready for a new patient or client. If you're a trainer or a clinician of some sort, and you're using a handheld device in your clinic or clinic treatment room or on the training room floor, you can easily do this with one hand. The site has been designed with this email push option to be primarily used with one hand so that you don't have to do a whole lot of intensive typing.
Now let's talk about something directly. Some folks might say, hey, aren't you using Eric Cressy's material and Gray Cook and Brett Jones material and K-Star's material? Yes, I am, but those videos at myrehabexercise.com are written for your patients and your clients' consumption. It's in plain English and wording that they can understand. The material that you see on those other sites is written for professional consumption. That's for the clinicians and the trainers to actually learn from. But what do you do once you then show your patients and clients how to do that information? How do you get the patient and client to follow up with that at home? That's why we put these videos together. In fact, I heartily encourage you to go and do the work, to go and do the seminars and check out the blogs and the other areas for people like Starrett and Cook and Jones and Eric Cressy. Here's some links right here on the bottom that you can check out to go and see those things, because all of us need to take our game up because people need help. And that's why we put this site together. Now, let's go and take a look and see what it looks like on the receiving end for that email.
So when I go to my inbox, I click on the Do Not Reply from myrehabexercise.com. And this is what your patients or clients will see. In this case, it's my demographic information since I was sending this to myself. And as you scroll down, you see that the Information about each particular exercise, including comments, frequency, and reps, and all of that is there. The patient or client clicks on one link and their exercises populate the window there. You see the sideline thoracic extension and rotation, the arm bars and screwdrivers, and the foam roll work only. That helps keep the patient or client from getting lost and a whole bunch of other stuff that they don't need to be playing around with.
So there you have it. You can see just how easy it is to incorporate this into your practice or your gym environment. We've got a special right now. You can trial the site for only $1 for 30 days and see if it works well for you. If you don't like it, risk-free, you can just discontinue the service. Take care and look forward to working with you.